Minglaba and welcome to MI Radio's Myanmar Today. I'm Agajo. Today we have reports on highway buses to stop running due to travel ban in some regions. And another report is on worrying shopkeepers at the Danyingone Wholesale Market. And a story coverage on Ministry of Health and Sports confirming 2 new death cases in Myanmar. And the last report is on the end of the month-long lockdown in Wuhan. All of that on this edition of Myanmar Today, but for now, let's take a look at what's happening in local news. State Councillor Aung San Suu Kyi wrote about the immune system and plans to distribute food supplies on her Facebook page yesterday. Recently, the phrase immune system keeps popping into my head, she said, and regretfully, 3 of our citizens have passed away because of COVID-19. All 3 who passed away had underlying diseases. That was why they were weak to fight the COVID-19. It means their immune systems were weak. I think people with underlying diseases and elderly people know that their immune systems are weak. Please don't forget that your immune system can become weak if you don't take care of your lifestyle and if you don't eat properly. Please take care of yourselves. Each and every one citizen is valuable for the country. The collective strength of the people is the immune system of the country. Starting from today, we will begin the program to distribute food supplies to all over the country to citizens in the basic strata of the society who don't have regular income. Union Minister for Health and Sports Dr. Mtfb looked into building a healthcare facility for treatment and quarantine of COVID-19 patients at the Central Institute of Civil Service, Lower Myanmar, in Pangji village of Legu Township in Yangon yesterday. Under the management of the Yangon Region government, the facility is under the construction of the Myanmar Construction Entrepreneurs Federation and the Myanmar Private Hospital Association. Yangon Region Chief Minister U Pyo-min also said the facility is scheduled to complete by 21st April with installation of the modern technologies, and his government will provide accommodations to the health workers and volunteers at the facility, which will include an internet network for video calls between the patients and their families at homes. The Yangon Region Transport Authority will erect mirror partitions between the patients and the drivers on the buses, which will be used for this healthcare center. The chief minister added he has no lockdown plan at the business city at the moment. The quarantine facility in Pangji village will have 20 beds at intensive care unit, 240 beds for high dependency unit, and 240 beds for patients, totaling 500 beds for the first phase. Transit centers in Naypyidaw and Yangon are keeping more persons under investigation for COVID-19 virus infection. A man and a woman who returned from China arrived at the center in Hlaing Township in Yangon on 8th April, while a transit center in Naypyidaw accommodated a man who arrived back from China and 32 men and 9 women from border towns Laogai, Dachile, Muse, Chaindong, Kale, Myawaddy, and Maungdaw. Up to date, 134 common people are now at the transit center in Hlaing Township and 284 common people at the transit center in Naypyidaw, according to the report from the Office of Commander-in-Chief of Defense Services. Local medical teams in Naypyidaw Command and Yangon Command are providing food and medical services to these persons who are in good health conditions. Following the EU's announcement on emergency fund for Myanmar garment workers yesterday, the Confederation of the Trade Unions Myanmar CTUM released a statement expressing thanks to the EU for the move. The statement said, quote, "On behalf of the workers of Myanmar and our affiliates, CTUM thanks the European Union and its member countries, the taxpayers who are the ordinary people from the emergency cash fund for the Myanmar garment workers who lost their jobs due to the COVID-19 pandemic. We also thank EU Ambassador His Excellency Christian Schmidt for expediting the process and the smart textile and garments for the thoughtful and concrete inputs to the EU. The emergency fund will be paying cash directly to the workers of the private sector garment and who lost their jobs in unexpected ways due to the COVID-19 pandemic and will cushion the hard social impacts." That's all with the local news. Now we'll move on to our first report. With the Ministry of Health and Sports confirming 2 new death cases on 8th April, The MOHS is closely monitoring and taking surveillance measures aimed at preventing against the COVID-19 with added momentum, and now there are 44 new persons under investigation. A 47-year-old man and 63-year-old woman infected with the COVID-19 died on April 8th, bringing the total number of fatalities to 3 and raising concerns about the dreaded disease in the country. Bomo and Ziamo has details.
With the Ministry of Health and Sports confirming 2 new death cases on 8 April, the Ministry of Health and Sports is closely monitoring and taking surveillance measures aimed at preventing against COVID-19 with added momentum, and now there are 44 new persons under investigation. The laboratory test results of the National Health Laboratory on specimen on a total of 33 persons under investigation have all tested negative. A 47-year-old man and a 63-year-old woman infected with the COVID-19 died on 8 April, bringing the total number of fatalities to 3 and raising concerns about the dreaded disease in the country. Dr. Ta Thonjo, the Director General of the Department of Public Health, spoke to MI Radio over the phone interview. He said,
The patient case 17 cough and blood was found in his cough, so we had to watch the patient with intensive care and special treatment. But yesterday night, the patient became worse and worse, and at about 4 a.m. in the morning, he lost his life. And we tried to send his children back to Weibaki Specialist Hospital in Yangon, where their mother is being kept under surveillance. And continually, the patient case 16 also died on the same day. Except these cases, other patients are in good condition. The case 7 condition has become better and has been found negative in the second time, and third laboratory tests already tested. She was discharged from the hospital on 8 April and will have to stay at a designated site for quarantine of 14 days.
According to that case, State Councillor Do Aung San Suu Kyi, chairperson of the National Level Central Committee on Prevention, Control and Treatment of Coronavirus Disease 2019, held a video conference with the persons concerning the battle against COVID-19 in Magui region on 8 April. The participants presented reports on awareness programs, especially aiming at giving education to the returnees from the foreign countries in the villages, healthcare services provided for 91 returnees at the 5 community-based facility quarantine sites in the areas of Saleh Station Hospital, and spraying of disinfectants. In the discussions, the State Councillor expressed her concern about home quarantine, as it is needed to be strictly followed and the rules related to home quarantine should be observed.
I would like to encourage that home quarantine need to strictly follow the rules capable of preventing transmission of the disease to other family members and community. The rural development is fundamental to the nation development, and also the less that were due to domestic infection. There are also possible challenges for those who complete their quarantine period in the coming weeks. They need to continue living according to healthcare guidelines, as some of them will begin to show the symptoms of disease. I would like to suggest the health workers, the rules of civil society organization, to serve as go between the administration and the common people, and the need for coordinated efforts to overcome COVID-19 crisis.
All major beaches and the transportation system will be closed from 10 April. There will also be less train routes in operation during the Danyingone period, and passengers are advised to check with Myanmar Railways on the various routes available. Government says that it will work to ensure that food supplies are accessible to all levels of society during the Danyingone holidays, even as the country tackles the COVID-19 outbreak in the country. The government says the effort to provide the food will begin 10 April, with state and regional governments collaborating together with government departments, chambers of commerce, civil society organizations, and volunteers on recording, packaging, transporting, and distributing to ensure there is no wastage, delay, or corruption. Additionally, the government's announcement by 6 April stated that households will be exempted for paying for up to 150 units of electricity until the end of April.
That's the report on MOHS confirming 2 new death cases in Myanmar. The confirmation of COVID-19 patients brought anxiety to people in Myanmar, but there are also some people who go out and work for their livelihood despite their fear of COVID-19. The basic income families cannot stay at home but go out and work to earn livelihood. The shopkeepers at the Danyingone Wholesale Market say they will continue to work and sell commodities at the market against all odds. Wilson has a full report.
Although there is no plan to close down one of the biggest wholesale markets in Yangon, the Danyingone Market, the shopkeepers here are worried that the outbreak of COVID-19 will affect their business greatly, and some say they are already somehow affected by the impacts. Some of the shopkeepers here have been doing the business at this market for many years, and this is the first time they have been into this sort of uncertainty and anxiety in years, according to them. It is also reported that some warehouses in Yangon are already closed down in fear of COVID-19, which makes the shopkeepers find hard to collect goods. Domyale Kai has been selling groceries for over 20 years, and it has been around 1 year since she has been selling grocery at the Danyingone Market. And speaking to my radio about the current situation of the sale, she said,
Comparing to the report before COVID-19, now we have less customers coming to the shop, but the sale is going up as people buy in a big amount. Some warehouses have increased the prices in the commodities. We buy goods at higher rates and sell them at higher rate as well. There are very few goods which see the decline of the price. We are worried that we will not be running this shop anymore if the situation gets worse. We are hoping for the best that the situation does not get the worst. In case if the situation gets the worst, the shopkeepers will face unemployment, which will also have a great effect on the public directly. This is why we are making sure that we protect ourselves well, and the customers also protect to avoid being infected. The only reason I am still running this shop is I am not that scared of the news. And another issue is, if I stop running the shop, life will be hard.
Although the shopkeepers are well aware of the danger of COVID-19, many of the shopkeepers say they have no preparation for any possible lockdown or enclosure of the market so far, but things are being run as usual. Wu Zomin is the vice chairman of Watermelon Exporters Association Yangon, and he has been selling watermelon since New Danyingone Market was open. And he also spoke to my radio on the current situation of the watermelon market. He also said,
The sale has been declining ever since the outbreak of COVID-19. In a normal day, we used to earn 3.5 million jets to 5 million jets in a day. But these days, we barely earn 100 to 200,000 jets in a day. So we used to sell the watermelon 2 to 3 full of 12 wheel trucks in a day, but these days we barely have the customers who buy for themselves and the distributors as well. So we are worried that we will not be able to run this business soon. As for me, I have orders worth of around 20 million jets from the farmers. So what we get to earn on daily basis is around 200,000 jets. So how are we going to even get the amount of money we invested put aside the profit? So I have already circulated to lose 80% of the total investment this time. So the main challenge is the business is not going well. Besides, I have staff to pay for as their salary. So the best decision I can make is to halt this business for some time.
Mamizing, who is also a shopkeeper at the Danyingone Wholesale Market, who is selling vegetable, and she also spoke to MI Radio on how her shop is doing, and she said,
These days, sometimes I get lots of customers, but sometimes there's a very lack customers. Every day is different. Sometimes the sale is going well, but sometimes it is not. But I make sure that the vegetables are being sold at a usual price without a decline or increase. For personally, I'm not that worried about COVID-19. However, I do take preventive measures by washing hands often and using hand sanitizers.
This is Williamson for MI Radio.
That's a report on worrying shopkeepers at the Danyingone Wholesale Market. Alright, let's have a look at the currency rates now from Myanmar's central bank and the stock exchange. $1 is at 1,429 kyats. 1 Chinese renminbi is at 202 kyats. €1 is at 1,553 kyats. £1 is at 1,771 kyats. 1 Singapore dollar is at 1,004 kyats. 1 Malaysian ringgit is at 329 kyats. 1 Thai baht is at 43 kyats, and the Indian rupee is at 18 kyats. Gold is trading as $1,681. Silver is at $15. And Brent crude oil is at $33. On the Yangon Stock Exchange, FMI is at 10,500. MTSH is at 3,650. MCB is at 8,500. FPB is at 21,500. TMH is at 2,800. Stay with us as we bring you more reports on Myanmar Today. The Yangon Region Transport Authority has decided to run the 226 routes of highway buses at Aomingla Highway Bus Terminal till 9th April and 11 routes alternatively till the end of Dinjan. But Manly Region Government has temporarily banned cars with more than 7 seats from 7 to 21st April. The measure is applicable to highway buses, pilgrimage buses, and private cars with more than 7 seats, except for trucks and ordinary private cars. Pultiritu has more.
Myanmar people are always alive with its special water festival known as Dinja, but this year, the COVID-19 crisis is going on across the world, including Myanmar. Therefore, the government prohibited public gatherings and events until 30 April. However, according to Yangon Region Transport Authority (YRTA), for the sake of the convenience and safety of the public, more than 1,000 buses in 56 routes are running from 12 to 16 April, the Dinjan period. U La Aung, Joint Secretary, Yangon Region Transport Authority (YRTA) said.
For the sake of convenience and safety for the public in transportation, we are trying as much as we can. We hope the public will cooperate in this process and follow the suggestion educated by the Ministry of Health and Sports while traveling. The YRTA is operating with the Ministry of Health and Sports before the confirmed case of COVID-19 in Myanmar, and we are watching and handling the entire possible situation in public transportation. We are raising the public awareness through audiovisual display, brochures and posters on the buses and bus stops, as well as the station with the instructions of Ministry of Health and Sports. We will directly inform if we find out doubtful case. Just after the announcement of COVID-19 as a pandemic disease, we are restricting the cleansing process of city buses and highway buses. We have instructed to use alcohol in cleansing all the space where the public is exposing. We are giving the hand sanitizer, mask and tissue to the passengers on the buses as much as we can. We have postponed all the public gatherings in aspect of YRTA, including the registration for city taxi until the end of April.
Annually, more than 250,000 passengers are passing through 3 highway bus terminals, Ao Mingla, Dagoia, and Dala for Danyingone holidays. The YRTA has decided to run the 226 routes of highway buses at Ao Mingla Highway Bus Terminal till 9 April and 11 routes alternatively until the end of Danyingone. But Mandalay region government has temporarily banned cars with more than 7 seats from 7 to 21st April. This notification, signed by Mandalay Region Chief Minister, was released by the region government on 4th April. The measure is applicable to highway buses, pilgrimage buses, and private cars with more than 7 seats, except for the trucks and ordinary private cars. U Nemiu officer Shwezin Sacha Express Bus Line said,
Every year, we sell the tickets for the seats just the start of March. All the tickets till 11th April were sold out already, but some regions, including Mandalay, banned the cars to enter the region, so Shwezin Sacha Express Bus Line cancelled all the running routes until 21st April. The express running to Naypyidaw at 5 p.m. on 6th April was the last run. We feel sorry to say our passengers cancelling the running routes, but we have to follow the government notification. About 30 highway buses are running from our Shwezin Sacha Express bus line Yangon every day. We are refunding each and every passenger of all these 30 buses for 5 days. We also suffer the losses, but for the consideration of passengers, we are refunding the ticket fees. They can be repaid when they bought the tickets and whenever, or they can postpone the date of the travel ban if they want. We are meeting their convenience.
Not only Shwezin Sacha, but also all the highway bus routes at Ao Mingla are getting cancelled. They are running. A passenger named Sultana Tun said her difficulties to Amma Radio.
I am planning to go back to my hometown, Yamete. I am working as an accountant in Lantaya Industrial Zone. I bought the ticket since the last month. I supposed to go back with this evening 6 p.m. express to Yamete. I have packed all my things, but now the car was cancelled. I will try to buy the train tickets if I can. I am not sure now I can go back or not. If I can't go back, I have to stay at my dormitory. I am glad to know we are being refunded for the tickets.
In some regions, those who come back from other cities or regions will be kept in a 14-day quarantine at designated community quarantine centers. I am Pyo Diridu. This is news reporting for MI Radio.
That's a report on highway buses setting to stop running due to travel ban in some regions. After the 76-day lockdown, Wuhan has finally lifted its outbound travel restrictions on 8th April. The city is gradually resuming back to normal status, but the citizens are still aware of the risk of the virus. Wuhan taking the virus spread under control is set as a hope for the rest of the world. Lord Aswesen has more.
On 23rd January, Wuhan City of Hubei Province, which is the epicenter of COVID-19 disease, was placed on lockdown in order to contain the spread of the virus. Millions of people were isolated from the outside world for 76 days. After the long battle as the disease has been brought under control, Wuhan has finally lifted its outbound travel restrictions on 8 April, which is a moment that many residents are longing for over the past 2 months.
People are now permitted to leave the city if they hold a green health code, meaning they're healthy and that they haven't had any contact with infected or suspected COVID-19 cases. At midnight yesterday, 75 checkpoints in Wuhan were removed. 52,000 people left Wuhan by train, air, and bus, and 31,000 people entered the city on the first day it lifted the lockdown.
As COVID-19 cases declined in Wuhan, China closed 16 temporary hospitals in the city. The city is gradually coming back to its normal status, and it is starting again its businesses. The people living in the infection-free communities can go out for walk if they hold green health codes. The public transport runs again.
The city's transport department said 346 bus and ferry boat lines, 7 subway lines, as well as taxis resumed service on Wednesday, as demands for public transport surged after Wuhan lifted its outbound travel restrictions. Over 624,000 passengers used the city's public transport from midnight to 5 p.m. on Wednesday, including 184,000 on buses, 336,000 on subways, and 104,000 taking taxis.
Hubei province reported 24 new asymptomatic infections on 8 April and a total of 674 asymptomatic carriers are under medical observation in the province. The document said that screening of asymptomatic infections will be stepped up, targeting close contacts of confirmed patients, people involved in cluster outbreaks, those exposed to COVID-19, and travelers from areas with high risk of infections.
Once verified, asymptomatic carriers will be put under concentrated medical observation for 14 days and can only be released from quarantine upon 2 consecutive negative nuclear acid test results, with a sampling interval of more than 24 hours. Medical institutions are ordered to report infections to their superior disease control departments within 2 hours of asymptomatic COVID-19 carriers being found through a direct web-based system.
The province is still aware of the risk of the virus. The experts keep ringing the alarm to stay alert.
Although Wuhan ended its month-long lockdown, residential communities in the city are still in close-off management. That's because reporting no new infections does not necessarily mean there's no risk of the virus in Wuhan. Although the city has achieved such important milestones in fighting against the coronavirus, people are still being urged to stay alert and avoid unnecessary movement. Don't forget that there are also asymptomatic cases being reported in the city. Experts now say that the risk of cross-infection within communities still remains. Therefore, it's still very important to continue with the closures in these residential areas.
The immediate action of placing under lockdown, the sacrifices of the health workers, and the cooperation of the citizens finally lead to the new chapter of Wuhan City after being the epicenter of COVID-19. And Wuhan remains as the hope for the rest of the world that are suffering from the most severe situation of COVID-19. That's all for now. This is Dora Susan from MI Radio.
And that's all we have for today's reports, and it's time to check on some international news here on Myanmar Today. The past 24 hours have seen a record number of Americans succumb to COVID-19. Hospitals are being overwhelmed. For more on what healthcare workers are experiencing, CGTN spoke to a nurse at Chicago's Northwestern Memorial Hospital. Chicago has seen a spike in confirmed COVID-19 cases and deaths, and that has put severe pressure on the city's healthcare resources.
It's obviously very overwhelming. We're used to dealing with a lot of really sick people, but because there are so many patients, it is kind of amplified. So I think mentally it is, it is difficult. We've had support for each other. We've had each other's backs kind of going into this. And it's just kind of amplified, I think, as this pandemic has just kind of progressed. People have been stepping up that, previously maybe weren't leaders, but are stepping up as medical ICU nurses to kind of show others the rope.
WHO Director General Tedros Ghebreyesus has defended its handling of the COVID-19 pandemic after U.S. President Donald Trump's criticism, quote, "Please unity at national level, no using COVID-19 for political points. Second, honest solidarity at the global level and honest leadership from the U.S. and China."
The focus of all political parties should be to save their people. Please don't politicize this virus. It exploits the differences you have at the national level. If you want to be exploited, and if you want to have many more body bags, then you do it. If you don't want many more body bags, then you refrain from politicizing it. Why would I care about being attacked when people are dying? Compare the two. We're losing lives every minute. My focus is saving lives. We don't do politics in WHO. We don't. We care for the poor. We care for those who are vulnerable because it's personally targeted to me. 3 months in the same situation. But still, they can continue. I don't care. But I assure you, we will do everything right in WHO. We will do everything that we can to serve humanity.
EU finance ministers have agreed a 500 billion euros rescue package for European countries hit hard by the coronavirus pandemic. The chairman of the Eurogroup announced the deal reached after marathon discussions in Brussels. It comes as Spain's prime minister said the country was close to passing the worst of its coronavirus outbreak. Spain has Europe's highest number of confirmed cases, with over 152,000. More than 15,000 people have died. The head of the International Monetary Fund, IMF, has warned the world is facing the worst economic crisis since the Great Depression of the 1930s. If our workers don't die from coronavirus, they die of starvation. This is a stark assessment of how the pandemic is impacting the clothing industry from garment factory owner Vijay Mahatne, the chairman of the Ambassador Fashion India. In normal times, Vijay Mahatne and his partners Amit Mahatne and Sean Aslam employ a total of 18,000 workers in 3 countries, they're Bangladesh, India and Jordan. But the outbreak has forced them to shut down the majority of the business, with just 1 factory in Dhaka partially operational. Coronavirus lockdowns aren't the only thing affecting their ability to pay their workers. They say their main problem is unreasonable demands from big clients, mainly in the US and the UK. And that's all we have for today. Thanks for joining me on Myanmar Today. I'm Akajo. Have a great day, everyone. Stay home, stay safe, practice good personal hygiene, and follow instructions strictly, and always be on high alert for important news. I'll see you again. Goodbye.